hits, he fails, he's really strong.
The street.
Yeah.
Okay.
I don't know how far he's gonna go in a crumble, but it looks like a big wiggle.
Welcome. We're glad you all found your way again over to the new digs here for formation. I'm tickled to. Now, Kristen's been here before, even since she may have been to Calvary many times, but since I've been here, you've been here at least one other time, where she led a forum on one of her other endeavors, Inspire Community Cafe, which I guess is still your deal. Okay. Kristen is, since November, has been Executive Director of Samaritan Counseling Centers of the Mid-South, November 2023, so you're still kind of
brand
new kid on the block?
New kid on the block.
I knew that was happening because Will Haley and Mary Fortin, I think, each told me we need to find a good executive director, and sent I can't say that I'm responsible for getting Kristen, but she comes with 25 years of experience in nonprofit management and leadership, her own consulting business as well that helps nonprofits do what they do best. She's worked with bridges and all kinds of good people doing good things around here. And this series during Easter that Catherine put together is talking about a series of hard issues. And she was brilliant to think that maybe Easter is a time to address or look at intractable issues and think that maybe something we couldn't imagine is possible. I was thinking this morning of, I think it was Jim Wallace had a wonderful old quote that he said, faith is believing in spite of the evidence and then watching the evidence change. So mental health is not something that's always on our minds, and so Kristen's going to give us a little bit of perspective and hope today. Thanks for being here.
Thank you so much. Thank you so much. Thank you, Scott, and also Robin. Thank you for getting me all hooked up this morning. And it's such a pleasure to be with all of you. And I see a lot of familiar faces and dear people that I've had the privilege of working with in the past and currently work with. So this is a real treat for me. And I was honored to be asked by Catherine and Scott and the team to come and speak on the topic of, good morning, fear not, facing mental health challenges faithfully. I've had the great privilege of serving as the Executive Director of Samaritan Counseling Centers of the Mid-South just for a little bit of time so far, which was actually founded here at Calvary in 1981 under the original name Episcopal Counseling Center. There are many people from Calvary who were involved in the early formation period or have been involved throughout its 43-year history. And I know that the Reverend Doug Bailey was instrumental in the beginning. I think I've seen Jim Boyd's name in a history document. The late Senator Taylor was interim executive director for the center. Paul McLean, I know you served on our board. Dr. Les Smith, Brooks Moneypenny, if I missed anyone here who's served with us, thank you. So I'm in good company, and your community has been and continues to be a major source of support for the work that we do. So thank you again, and I'm excited to be able to kind of lead a discussion with you all today and also update you a little bit on where Samaritan is today. So, on to our topic of fear not, facing mental health challenges faithfully. I would argue the first step in facing mental health challenges faithfully is to recognize we are not alone. Scripture is full of messages that encourage us to fear not because we are not alone. God is with us, and with the companionship of a compassionate God, we can be a companion for one another. And in preparing for this, I kind of rediscovered a scripture that I have read now in a new way, kind of with the lens of mental health. So I'd like to share the scripture from welcome. Hi, come on in. More friends, come on in, more friends. We have enough seats.
Okay.
Welcome. Hello. Welcome. You get the front seat when you show up like, hey. Guys, hello, I'm Kristen Fox Troutman. I'm the Executive Director for Samaritan Counseling Centers in the Mid-South, and we're just getting started. We're reflecting on our theme of fear not, facing mental health challenges faithfully. And we're kind of beginning with just a small meditation on a scripture that I think really grounds and roots us for this conversation. We have the Isaiah scripture that we're all familiar with, fear not, for I am with you. And I kind of rediscovered this scripture from 2 Corinthians. Welcome, welcome. It says, "Praise be to the God, the Father of compassion and the God of all comfort, who comforts us in all our troubles, so that we can comfort those in any trouble with the comfort we ourselves receive from God." So today, together within a community of caring folks who are cared for by a compassionate God, we can faithfully discuss this issue, which is not always easy to discuss. Many of us have been taught, either directly or by the noticeable silence around this issue, that it is not okay to talk about mental health. But the more we openly discuss issues of mental health and the importance of mental wellness to our overall quality of life, the more we will normalize and destigmatize it. In the same way we can talk about diabetes and the acceptable use of insulin to care for those with diabetes, or cancer and the use of chemotherapy to treat cancer, my hope is that we will be able to talk about mental illness and all forms of treatment that may improve someone's mental health, and to talk about these issues openly and without shame or discomfort. This work of destigmatizing mental health begins with each of us. We can set the example. And I have to tell you that I recently had an opportunity to meet with your amazing bishop, Bishop Phoebe. She's quite an amazing woman, and we had a beautiful conversation about this, about the importance of destigmatizing mental health and talking openly about it. And I really appreciated her courageous leadership, and the fact that your community here is hosting this conversation shows that you all are stepping out in leadership in this work. So I really appreciate that. And I will share today a little bit about my own journey as well, and how I have benefited from mental health services. And I think that each of us just stepping out, taking the courage to share a little bit of our own journeys will help. So again, you are not alone, we are not alone. Over our lifetimes, most of us will face some type of mental health challenge. Personally, within our families, within our church community, our workplaces, our neighborhoods, our city. We are all humans who will face challenges in life. Challenges that may impact our emotions, our thinking, and our behaviors, and that is okay. We are not alone, and it is okay to seek help. We can faithfully face these challenges by knowing we are not alone, and by growing our awareness of mental health warning signs and resources for healing and growth. And we can also be faithful in helping to increase access for those most in need of mental health services by becoming advocates, connectors, and supporters of organizations like Samaritan Counseling Centers up in Mid-South. I'm going to share just some big picture statistics about mental health in the United States provided by the Substance Abuse and Mental Health Services Administration, the SAMHSA.gov, the CDC.gov, and the NAMI.org. Those are all really good websites to find some good reliable data on this topic if you want to study this further. So more than 1 in 5 adults, if you just look at our room of 20 or so, right, 4 of us or more, in a given year experience a mental health challenge. Over 20%, 22.8%. 5.5 or more than 1 in 20 adults experience a serious mental illness within a period of a year. 16.5% of U.S. young people ages 6 to 17 experience a mental health challenge each year. 6.7 of U.S. adults experience a co-occurring substance use disorder and mental health illness each year. Some of the most common challenges that we see in our country and our world, I don't think any of us will be surprised to learn that anxiety and related issues is at the top of the list. We live in a very fast-paced, very complex and interconnected society. 40 million adults in the U.S., or 18%, have an anxiety disorder. Good morning, welcome. Make room. Good morning, welcome. So 18%, again, that's close to that 20%, close to 1 in 5. This is something, and these statistics are kind of based on those that might meet the DSM-5 diagnostic criteria. I think that's probably not a stretch to say most of us who live in this society have some experiences with anxiety, and it sometimes negatively impacts our day-to-day life. Approximately 8% of children and teenagers experience the negative impact of anxiety. At Samaritan, our therapists confirmed that over the past several years, anxiety has kind of risen definitely to the top of why people are seeking help at Samaritan. I found this kind of shocking. Depression worldwide is the leading cause of disability and is a major contributor to the global burden of disease. In the U.S., physician office visits where depression is indicated in the medical record, more than 1 in 10, 11%. Welcome. Do we have, is that another seat?
Yeah, come on.
Come on in, come on in. This one is I think the toughest one for me, especially. I have 2 young girls, a preteen and a young adult, and so I think we all were shocked with some of the data that came out over the past couple of years that suicide is now the 2nd leading cause of death among young people aged 10 to 14. And the 3rd leading cause of death among those aged 15 to 24. Suicide is the 12th leading cause of death overall, all age groups in the U.S. And 12 million U.S. adults had serious thoughts of suicidal ideation in 2020. I know that there is also a lot of conversation and research coming out around the impact of social media on mental health of teenagers, especially young girls. And so a little bit later in the talk, I'm going to share with you about an educational opportunity that we're hosting through Samaritan on this topic of social media use and teens, and some guideposts for parents and grandparents, those of us who love adolescent girls and boys, and how to help provide support and guidance for them in their social media use. That talk is going to be led by our own Dr. Lindsay Pate. I'll share a little bit more about that in a minute. Substance use disorders, according to the National Survey on Drug Use and Health, 17 million U.S. adults experience both mental illness and a substance use disorder. Those are both usually considered co-occurring. Due to diagnosis, often people use substance, right, to cover up symptoms of some other type of mental illness. In recent years, the use of opioids has been on the rise in the U.S. This is something I know we're all very familiar with too. It's become an epidemic and a crisis. Something that I didn't know until I was preparing for this talk is that the National Institution on Drug Abuse released data for the opioid prescription rates and opioid overdose deaths this was a 2017 report. Our state of Tennessee had the highest opioid prescription rate of all states. I did not know that. We have the 2nd highest drug overdose death rate, just behind West Virginia. Did not know that. Did not know that. Actually, West Virginia is very high on the charts. It's like a serious epidemic there. But Tennessee is 2nd. Did not know that. And again, this site, the National Institute on Drug Abuse, has the report if you want to dig into those numbers. There's a lot of statistics there. Other mental health conditions, and this is an annual prevalence rate, so on U.S. adults. Just give you a moment to look at those. So post-traumatic stress disorder, 3.6% of the U.S. adult population. But again, we know even if someone has not reached the DSM-5 diagnostic criteria for PTSD, we know the impact of trauma in our community and the impacts that has on children and on adults I know many people were involved in the work around ACEs here in our community. Just a reminder that the 2017 study, more than half, 52% of our population here in Shelby County have experienced at least one adverse childhood experience, one traumatic event. 21% reported experiencing 2 or 3. 12%, that's more than 1 in 10, reported experiencing 4 or more. And the studies show that when you get to that 4 or more mark, the impact on health throughout the lifespan is really significant without intervention. So we have just dealt with some difficult statistics, but I want to just pause and recognize that each statistic represents a person with their own unique story. So let's just pause for a minute to think of the people in our lives, including ourselves, who may be experiencing a mental health challenge, and remember that they are not alone. You are not alone. We are not alone. To humanize this issue, I'm going to share a personal experience with you. Lead by example, like Bishop Phoebe gave me the courage to do when we were talking. When I was a sophomore at Rhodes here in Memphis, my parents went through an ugly divorce. And the circumstances that ultimately led to their divorce were present at different periods of my childhood. It is clear to me now, looking back, that my parents did not have the resources for healthy coping mechanisms to deal with marital challenges or the traumatic situation of a divorce, and neither did my sister or I. We just did our best to muddle through, but we suffered immeasurably throughout and after the process of my parents' divorce. At that time, in a small town in Tennessee, I was raised in Union City, Tennessee. There was little to no talk about seeking help during emotional or mental health crises. There were likely not any professional licensed therapists in my hometown. There may still not be. So no wonder we didn't access support or even know how to seek help or where to go to for help. It was just not something you talked about or dealt with. So I am now personally immeasurably grateful for the significant progress we have made in destigmatizing mental health and access to care, even though we still have a long ways to go. Because of courageous people who feared not and spoke out about the need for mental health care and worked to expand mental health services, more people today, including me and my parents and my other family members and friends, so many benefit now from this advancement and access to counseling and other services. So how can we continue to support the advancement of mental health destigmatization and access to care? One of the ways is to continue to educate ourselves, like we are today, on the common mental health challenges that we will all encounter in one way or the other in our lifetimes, and the warning signs of these challenges and ways we can help point people to the right type of care they might need. So this is from NAMI's website, some common warning signs. Would someone be willing to share, just to read out the list on the left over here? Yes.
Feeling very sad or withdrawn for more than 2 weeks, trying to harm or end one's life or making plans to do so, severe out of control risk-taking behavior that causes harm to self or others, sudden overwhelming fear for no reason, sometimes with a racing heart, physical discomfort or difficulty breathing, significant weight loss or gain.
Would someone be willing to read this other side?
Seeing, hearing, or believing things that aren't real, excessive use of alcohol or drugs, drastic changes in mood, behavior, personality, or sleeping habits, extreme difficulty concentrating or staying still, intense worries or fears that get in the way of daily activities.
But this is just kind of a general list, and clearly each challenge that people may face will have its own manifestation of symptoms. This is just kind of a general list of warning signs. Now that we know these warning signs, we can be more sensitive and aware of the people around us who might need a caring friend or family member to check in on them, to provide a presence of compassion and a listening ear, and to possibly help point them in the right direction for appropriate care and support. So now we are in Easter season. Get to the hope. There is hope for mental health. Of the 58.7 million adults who perceive they have had a mental health problem, 66.5% consider themselves to be in recovery or to have recovered from their mental health problem. So mental health issues, even some that are severe, are not intractable. There are resources, treatments. There's a lot of advancement in this field that really does provide relief and recovery and healing for many, many people. So that's, I think, another message I'd like to communicate today is that we are not alone, and also there is hope. There are resources. Not enough resources, but there are. So people are healing, growing, recovering every day. Fortunately, many high-profile people, celebrities, and others that are well-known have started to speak out and been very courageous and share their own personal stories of mental health and recovery. We probably all know about Robert Downey Jr.'s significant struggle with addiction that led to multiple arrests and time in prison, pretty low point in life. He found healing and recovery in an intensive inpatient recovery facility, and then has credited meditation, 12-step programs, yoga, his family support as resources and mental health practices that have supported his recovery and subsequent re-emergence of his acting career. Pretty cool story of hope and recovery. I had not been personally aware of Eric Clapton's mental health journey, but I learned that at one point he was spending $16,000 a week on heroin and was also abusing other substances. He has now been sober over 25 years and has served on the boards for several treatment centers and founded a treatment facility in 1998. Kristen Bell, renowned actress and singer, has been public about her challenges with anxiety and the benefits that she received from counseling and medication. Other people like Michael Phelps, Katy Perry, there's so many that are speaking out now about their own struggles with mental health issues and how they have received relief and help from a variety of treatments. So I'm grateful for that trend, and I think that's really helping a lot of young people. I know from having young people that they do kind of look to and find, if the people that are kind of, celebrities are speaking out, then it makes it a little bit easier for them to talk about this issue. So I'm really grateful for people that do speak out. So this is just a real broad list of treatments. I'm not a mental health professional, so this is just kind of a broad overview of the types of treatments that exist. And again, there are advancements in this field happening every day, which is really cool. Medication, there are a lot of different medications and medical advancement that really help give people relief and healing from a variety of mental health challenges. Psychotherapy, which is what Samaritan provides, also known as talk therapy or counseling. There are alternative therapies like art or music therapy, which give people relief. Mindfulness practices, I know there's a ton of research on how mindfulness practices benefit people and their mental health. There are support groups like AA groups, divorce recovery groups, grief and loss support groups. A lot of research on that, how peer support is a really huge resource for people who are going through things when they really can feel like they're not alone and they can share those experiences together. Inpatient residential treatment. There are several facilities in our community that are available to people that can provide a more intensive treatment when there's a more serious issue or crises. Outpatient treatment programs, you might have heard IOP, that stands for Intensive Outpatient Program. This allows people to stay at home, but then go during the day to go to groups and receive other types of treatment. Dual diagnosis treatment, I mentioned these are for individuals who struggle with both mental illness and substance abuse or substance use disorder. So again, today I'm going to focus on the impact of psychotherapy, since this is the focal point of Samaritan. So it's really hopeful too to know that the research shows that most people who receive psychotherapy experience symptom relief and are better able to function in their lives. About 75% of people who enter psychotherapy show some benefit from it. Psychotherapy has been shown to improve emotional and psychological well-being and is linked with positive changes in the brain and body. The benefits also include fewer sick days, less disability, fewer medical problems, and increased work satisfaction. With the use of brain imaging technology, researchers have been able to see changes in the brain after a person has undergone psychotherapy. Numerous studies have identified brain changes in people with mental illnesses, including depression, panic disorder, PTSD, other conditions as a result of undergoing psychotherapy. In most cases, the brain changes resulting from psychotherapy were similar to changes resulting from medication. So this is a pretty darn high success rate, I would say. I am personally also fascinated again by the advancement in the brain imaging technologies and what they can teach us about the brain and mental health and the links between neurological health and mental health. That's a really kind of emerging field to pay attention to. So now that we've looked at the prevalence of mental health challenges, the advancement in destigmatizing mental health, and the benefits that different types of treatment can provide, now we're going to face the hard reality, is that even knowing that most people could find relief and recovery from mental illness if they had access to treatment, many people do not have access to the care they need. You are going to be shocked by some of these figures, as I was, I think that you will. So out of 50 states, Tennessee is ranked 45th in access to mental health care. The study used these 9 measures to make up their access ranking scale. So that's something that I know we're not pleased with. Approximately 50% of all adults and children across the U.S. who are diagnosed with a mental health condition do not have access to the care they need. That's 1 in 2, 50%. So when a study asked people about the specific barriers to accessing care, 80% cited cost, and more than 60% cited shame and stigma as the main obstacles. The shortage of mental health providers is also prohibitive, with 60% of psychologists, U.S. nationwide, reporting no openings for new patients. In many rural areas, like my hometown, and economically stressed cities have few, if any, behavioral health care providers. For example, in 2018, more than half of the counties in the U.S. did not have a practicing psychiatrist. One study found that counties outside of metropolitan areas had 1/3 the supply of psychiatrists needed and half the supply of psychologists as their more urban counterparts. As of March 2023, 160 million Americans live in areas with mental health professional shortages, with an estimated 8,000 more professionals needed to ensure an adequate supply. So a little point of hope, just since I've entered into this job and I've really started to try to understand the landscape of mental health, and we're trying to hire 2 licensed clinical therapists, which is become a challenge. What I'm seeing is that there is a pretty significant increase in the new pipeline of professionals. There are some resources going into that, which makes me hopeful. But we're still kind of in that period of building that resource pool that we need. In Tennessee, according to a 2019 report, there is only 1 mental health provider for every 660 residents in Tennessee. Further, the Health Resources and Services Administration reports that at least 95% of counties in Tennessee, remember I said nationwide, it was half. In Tennessee, at least 95% of counties have mental health care provider shortages compared to the national average. So I learned a lot of this data after creating this PowerPoint, and it's Robin, I'm going to put a slide about this in presentation for future use because those are really pretty striking. So again, we're going to keep coming back to hope. We are in Easter season. Here we go. So within this context of unmet need, Samaritan and other organizations are on a mission to help meet these growing needs. Founded in 1981 by Calvary's own, the Reverend Dr. Douglas Bailey, and several other members from your community, offers hope and healing through high quality, affordable, accessible, and professional counseling while respecting the personal and spiritual values of individuals. We offer a sliding scale fee structure and a low fee supplement fund that make our services accessible to all people, including people of low incomes, no insurance, or low reimbursing insurance. So again, despite the positive benefits of psychotherapy, we've learned what a lot of the barriers are. Cost is one of those. The average cost of a psychotherapy session in our state is $130 with, on our low scale fee, our sliding scale fee, excuse me, that's based on income. Someone could pay as low as $40 per session for professional high quality counseling services. Also, a lot of the facilities in our communities, because of the shortage of health professionals, do have pre-licensed professionals working, and you know, there's a lot of new people coming into the field. We do have a really strong commitment to having high quality professionals who have their licensure, who've met all the qualifications needed. We have currently 6 therapists on our team. The credentials, we have 3 PhD psychologists, we have a licensed marriage and family therapist, a licensed professional counselor, and a licensed clinical social worker. We are working very hard to fill 2 new positions. Let me know if you know of a licensed professional therapist who would love to work and be a part of this important mission. And also our providers take a number of insurance plans, which has become a huge barrier to care for so many. If you have sought personally to find counseling services, you will find that most professionals do not take insurance because it is a pain in the butt to take insurance. And I really think, just again, I'm trying to name the fact that we take insurance is a part of our ministry and our mission, because it is so much easier not to do that. So we have 4 conveniently located centers throughout the metropolitan area. Our main office is next to Idlewild Presbyterian Church off of Auburndale. We have an office at First Baptist Church, which is currently being renovated, but will be back in use soon. Church of the Holy Communion and Germantown Presbyterian Church. I have learned over our 43-year history, there have been different locations throughout our history. The first one was located here at Calvary. And so we do hope, I'd say, long-term vision, right, to expand our locations. I think that's a longer-term need, and we want to make sure that we're accessible, especially in high-need communities. So that's, again, long-term strategic thinking around our work. So just practically speaking, you need to want to get an appointment with a Samaritan professional or refer someone to us. It's as easy as a phone call or sending a simple email through our website, SamaritanMidSouth.org. We have a contact page. Those go directly to our clinical lead therapist, Dr. Earl Donaldson, and our clinical lead really aims to respond to all inquiries as quickly as possible within a 24-hour first business day. There's a brief triaging to match the potential client with the appropriate therapist based on presenting problems, preference for therapist, location desired, insurance or self-pay, scheduling requirements, and then the most appropriate therapist will then be contacted by the clinical lead and provided with the inquirer's contact information, so then the inquirer will be contacted directly by the referred professional. So just so you kind of know, there's a little process there, but it's aimed to make it as smooth as possible, and then able to get someone in for initial intake. So just to give you an idea of kind of where Samaritan, what we've been working on and growing, and I'll say since y'all heard I came in late 2023, all of this credit goes to Will Haley and Mary Fortin and others that have served on our board. Will and Mary serve on our executive committee, are very hardworking board members, and I'm extremely grateful for their service. They have done an amazing job of really getting Samaritan back on track after the pandemic. That was hard for everyone, and really get the organization on strong footing and positioning us to be able to grow and meet growing need. So a few highlights: the board raised enough money to hire me, thank you, in 2023. They raised 45% more in donations and grants than in the prior year, and this is really awesome. 50% of new donors, 50% of donors were new donors, new people coming into the organization. We've recently implemented a new electronic donor management system. Welcome to the 21st century. An electronic health medical record by using a grant from the Community Foundation. We received first-time grants from the City of Memphis and Shelby County. Received a generous gift from Dr. Hal Brunt and Ms. Fuzzy Hussey to get new landscaping at our main office. So just a few kind of highlights. Also just a few service statistics. So we provided 3,281 client sessions in 2023, and 34% of those were low-fee supplement sessions, sessions that were supplemented by our low-fee fund. But you'll see that, again, Samaritan genuinely is for all people, and I think that makes us unique. It is not just a place where people who couldn't afford high-quality services elsewhere go. It is for people that can pay full price, have great insurance. We will take all of that, and also for people that might not be able to afford the full price of counseling or may not have insurance. So it really is genuinely a service for all people. And since I've been working here, I've been really pleased that just out and out in the community, people come to me and say, I went to Samaritan and it really helped me. So a lot of people that we know and have accessed resources from Samaritan, and I'm really happy that we've been able to be a resource for all people. And I just also want to mention, because we're talking about some of the successes, we are currently a finalist in the Give 365 grant program. So if you happen to be a Give 365 member, you have like a week and a half, I've learned, to vote. Please put Samaritan at the top of your list. We need your support. Seriously, if you do have people in your family that are part of the Give 365 community, we would really appreciate receiving those funds to continue to grow our mission. So a few areas of growth I've mentioned. The first one here, we're trying to hire 2 new therapists. So let Will know if you come across somebody, call me up, let me know. We're working to increase our partnerships with individuals, churches, and community organizations to expand our support and referral networks. We're developing a 3-tier partnership model so that any church or nonprofit organization could start as just a referring organization. We just want people to know about us, know who we serve, kind of how our payment model works, so that you can help direct people to care. So that's a great way. Any organization, any church can be a part of that. All they have to do is learn about us, have materials about Samaritan, and then help people find us if they need us. The next level would be being a financial supporter, and I appreciate Calvary's support of Samaritan. And then we have our host level congregations who provide the in-kind space, office space for our therapists, which is a huge part of our operational model that allows us to do what we do. To have those in-kind contributions of our counselors' office spaces throughout the city is, again, a really significant part of how we're able to operate and provide our mission. So ways you can engage with Samaritan. First of all, you can reach out to Samaritan for counseling services. For yourself, for your family members, loved ones, people you may encounter. We are here for all people. So reach out if you need us. Please help us spread the word about Samaritan now that you're learning about us today. tell your friends, tell your family members, your neighbors, your coworkers, let them know we're here, we're available. Donate to Samaritan, tax-deductible contributions support our operations, our low-fee supplement fund, our educational programming, and you can attend one of our upcoming mental health lunch and learn series, which I'm going to tell you about. So I'm excited. This is a new thing that we're doing. Education has always been a part of our mission, and a lot of our staff therapists go into churches and other organizations to give talks on different mental health topics. This is a public-facing event. This is a free event due to our generous sponsors. And you'll see Mary and Will on this list too. You see how deeply invested they are in our work. And so because of that generosity, these are free, open to the public. These are some really great topics. This first event is coming up in a week and a half, May the 1st. I have some postcards over here with QR codes, and I'll have a QR code up here too. You can just click on. It's a free event, but we do ask you to pre-register so we'll know how many lunches to get for the event. Jamila Batts, I've really loved meeting her. She is Master's of Public Health from Emory, Master's of Medical Anthropology. She's a registered nurse, and she's a mental health first aid instructor. She is leading our first talk. She's giving kind of an introduction to what does it mean to be a mental health first aid provider. And then she is making available after this talk in June a full day training for people within our network to come and be trained as a mental health first aid provider. And this again will enhance skills of being aware of common warning signs of different mental health conditions, how to respond to people. Sometimes it's hard to know if someone is experiencing something. How do you approach them? What do you say? What do you do? And then helping people to get plugged into the right level of care. So come and learn more about that. That's at First Baptist Church off of East Parkway. Enjoy a free lunch, a good talk, get inspired to get more plugged in. This is the talk I mentioned about teen mental health and social media that's going to be led by Dr. Lindsay Pate at the beginning, right before the school year kicks off, so we can make sure we're equipped and ready to support all of the teens in our lives. And then in November, right before the holiday season, we're going to focus on the amazing research around resilience and hope. Dr. Sean Phipps is a new board member. He was the director of psychology for St. Jude for many years, and he is graciously offered to, he's a board member and also going to lead this talk for us on his research while at St. Jude for many, many years. So please do, that's a really easy way for you to support Samaritan, get plugged in, and build your own knowledge base around mental health. So I hope you'll be able to join us there. I'm going to put these up on the screen just a little bit. If you're tech savvy and you want to go ahead and get these links in your phone, this first one is going to lead you to the registration page for our Lunch and Learn series. This second link is to our donation page. I'm going to come back around to that and just leave it up there, you know, so you can easily access that. I also have, if you're a paper person, we have some literature over here, a flyer about the events. There's a brochure about our services. My business card is over there. Call me if you'd like to talk more. I'm happy to have lunch or coffee and share more about what we're doing. And I'll just pause now. We have talked a lot about this difficult topic where we are faithfully facing it. I want to just take us back to our meditation and close out with the reminder about how we can face these difficult topics because we are not alone. Fear not, for I am with you. Praise be to the God, the Father of compassion and the comfort, the God of all comfort, who comforts us in all our troubles, so that we can comfort those in any trouble. Oh! With the comfort we ourselves receive from God. 2 Corinthians. I'm not sure where that went, but just in time, we made it. That was it. That was it. Thank you. You went to good 365 page. You heard I got buzzed right at the end. Didn't get to get my last sentence in, but that's okay. So this is a theme, but anyway, if you have any questions? I think we have just a few minutes.
We've got 5 or 10. This is actually, they must trick the boys because that's a little fast.
Oh.
It's right at 10 o'clock. We have 5 or 10 minutes for some questions. questions. What do you have for Kristen?
What's the lead time to get any more credits?
Okay, that's a good question. And what I've learned since being there since November is that it does ebb and flow, because our therapists might be full at one time, and then there might be some people that you know, are finishing up their therapy, and so spots open up. I will say that we had one provider who is out on family medical leave who is just coming back and rebuilding her client base. And she also sees children, which is great because that's a huge need. She sees all ages. So I know because of that, you know, we have some openings. We are very close to hiring one of our 2 new people. She's going to hopefully be coming on a part-time basis. So again, so I would say that it should be easier right now. There may be some time, if you called at some time in the year, just that we could be full. That is the reality. I've learned that we used to take waiting lists, but then we moved away from doing that because our clinical lead felt that people would wait to access care elsewhere if they were sitting on a waiting list, and so didn't feel that that was the best client-focused approach, and so we just encourage people to call back later. So we don't have a waiting list, but again, I think that it's pretty easy right now to get in within a week or 2 for that initial intake appointment. And so, but again, I do know that it ebbs and flows, but we're working to increase that provider capability, and again, we'll be working really hard to fill these open positions. So I would say our longer term trajectory, especially this year and next, is going to be, there's going to be more openings. Yeah, great question. You had a question about somewhere, did
It was me. I was wanting you to repeat the question.
Oh, it was about how long does it typically take?
Eventually.
Yeah, how long does it typically take to get in to see someone at Samaritan? Yes.
Does Medicare cover any of this counseling?
That's a great question, and to be honest, it's complicated. The insurance stuff is really complicated. So yes, there is some coverage. I know that there's been some recent wins in Tennessee and nationwide around increasing healthcare, insurance coverage of mental health care, but it's not sufficient, right? People often still have high co-payments, or there's a limit to the number of sessions they get and things like that. So I would say there's still a lot of room in the advocacy realm and policy realm around care and insurance coverage. I know that it's been an internal struggle for us around TennCare because understandably people that are on TennCare have many barriers to getting care anyway in their life in general. And so there's a high no-show rate for those particular clients, and the TennCare policy does not permit you to charge a client for a no-show rate. Where if it's a private client, there are policies where if you just don't show, you will be charged something for that. And so it's a tricky thing that we're trying to work on and trying to figure out how to be creative with our low fee supplement fund. Are there ways to, things that we can do to increase access, maybe do telehealth. I didn't mention that, but telehealth has really opened up access to a lot of people who have barriers for transportation and childcare and things like that. And we do have all of our providers through our Simple Practice program have a HIPAA compliant telehealth capability, and some prefer to not do telehealth, but most do offer that as an option. And so that is, again, I would say to your question, yes, there is some coverage through the public benefits. That's not sufficient to my knowledge, and there are some barriers for providing care for those policies because of the low reimbursement or the no-show policies.
It's also just a complexity. Because this insurance sort of complex, and it's very complex, and everyone's got their own rules, etc. And it's a challenging way to seek compensation. That was very well done. I just want to add one thing. We could not do our work without the dedication of our therapists. Our therapists are just great people, and we're in good shape now, but when we were in lesser shape, many times they saw people for $20 an hour, and they took the hit right out of their own pocket, and they're all mission-driven folks. They're good folks, and I would add one other thing is that if you know a therapist doesn't need to be in a job search mode to talk to us. If they're interested in a mission-type culture, please send them my way. We'll just have a conversation with them and not necessarily a recruitment talk. Thank you, I'm sorry.
Do you have an next part of that?
What kind of relationships, what kind of partnerships do you all have with other nonprofits in the community? Are you providing counseling services for, I don't know, I was there, the other night at the 365 event, so there are a lot of those organizations struggling to provide mental health counseling too. Are they referring clients to you by chance?
Well, it was great because I knew some of those organizations before, but really got to meet others and talking about that kind of mutual referral relationship. I would say one of our therapists was a long-term youth villages. He was the head of crisis counseling youth villages for 20 years, and so because of his relationship there, we get a lot of referrals from youth villages.
Yeah.
We also have recently met with folks at Church Health Behavioral Services to see, where we can work in tandem because, typically people that are current patients of Church Health who are, working with the people that meet their criteria, we can see someone there, but there are people that walk in that maybe don't meet the criteria that they can then refer to us. So we do get referrals from places like that. I know, we have been getting referrals from the Kinder Place sometimes as well. And so yes, I think because Samaritan has been around, there are a lot of mutual referring relationships, and if we can't see someone or it's not a good fit for us, then we refer out as well to a number of other organizations. And I think it's just hearing and, kind of facing the fact that, we are in this serious health provider shortage issue and all the other things is that, I think that people have to collaborate to try to meet the needs of people. And so I think there is a good amount of collaboration, but then also, of course, there's always in the nonprofit world, like there's missed opportunities for collaboration too. So that's something I really, I'm passionate about too, is really, again, better understanding our place within the broader kind of landscape and how we can best, serve, provide what we uniquely do within that kind of broader context. Good question. Yes.
Do you have any option for a client that might need intensive inpatient care?
We do not provide that level of care.
No, not you.
Oh, do we know of someone?
Yeah, do you have any referral option right now?
Well, I do know that the main organizations providing that care are Lakeside Behavioral Services and Crestwind Behavioral Health. I think Memphis Mental Health Institute is going to take people who are on TennCare or Medicare, Medicaid. And then are there others? There's other mental health people in the room. Are there other, I know it's dual diagnosis. There are a number of kind of addiction treatment facilities. My husband's the medical director of one called Oxford Treatment Center in Mississippi. There's also, I think the outpatient model, the intensive outpatient model, the IOP model is really an expanding model. There's a network called Professional Care Services, or PCS. They're working to expand in this area. They're in a lot of rural communities in West Tennessee. But there are definitely inpatient providers. And some of the hospitals have kind of a crisis unit where if someone just comes into the ER, they are able to kind of provide basic stabilization services until they can get to a longer term inpatient treatment facility. Does anyone else have knowledge to share around this? Like people are aware of inpatient facilities that I haven't named?
I think as far as the hospital goes, it used to be, I'm not sure right now, but St. Francis Park Avenue had an area or a floor there where they did.
Yeah, so these are great questions. Yeah, where I want to make sure I know. It's kind of like, it's hard. It's like, lots of moving pieces and puzzles. And I was going to try to include a slide of a map of all of the different services. I couldn't get my Google Maps to really cooperate in time to really show a good list. And so there are, a lot of practitioners on the counseling side are going the private practice route, to be honest, and because of the insurance issue and are only taking cash. So again, if you have financial means, it's not as hard to get in to see a counselor, but it is very difficult if you don't have insurance or the financial means to pay for private counseling. Any other questions?
We're gonna have to move next door, but this
Okay,
is
thank
fabulous.
you.
Thank you.
Thanks for having me.
Yeah, thanks for what you're doing. Thanks. See you all in church. Next week is, can't remember who next week is. It'll be great. Also.